Neovascular glaucoma, the knowledge series. The common causes for neovascular glaucoma are diabetic retinopathy, central retinal vein occlusion, or the branch retinal vein occlusion. There are other various causes as well. So what do we really see in the fundus is you can see the neovascularization of the disc and also the neovascularization elsewhere in the retina like a PDR. Then when you have a patient with a CRVO, what is that you have to really focus is how many soft exudates that you can really localize. More the number of soft exudates, more the chances of you getting the patient with a neovascular glaucoma. The next thing is when you look at the iris, there are a few things which you have to really locate. One, first step itself, you have to really magnify and see these patients. You may not really pick up in every patient that you can see all the findings, but if you can magnify without missing any findings, you should pick up all these findings. One, ectropia nuvae. The moment you see the ectropia nuvae, you should understand the patient has already developed a angle closure disease. The second step is when you see the neovascularization of the iris, the tuft of vessels can be seen just at the pupillary margin. That is stage 1. The stage 2, you can see that it is going up to the collarate. In stage 3, it crosses the collarate, and in stage 4, it gets into the angle. So what you see in the iris is basically a single layered blood vessel showing the RBCs. You can see that arrow mark is showing you the single layered blood vessel. So what you see in your gonio, you can see the arborization of the blood vessels in the angle, which can easily bleed. So this is the angle. You have to really magnify and see. The importance of this angle vessel is when you are taking up the patient for a surgery in a neovascular glaucoma, you must see that when you are doing the peripheral iridotomy or when you are doing the punching, you must be careful to avoid that area so that the bleeding can be reduced. The next step is to see how active the disease is. If you see the old clotted blood and also the fresh blood, then you can understand the disease is quite active. Also you can see the blood mixed aqueous. This is the fresh blood. The color is different from the old clotted dark blood. This is the next stage where we have given probably the injection. Now the eye is quiet. You can see that is the ghost vessel. The ghost vessel, the color is different. You can see from the picture. The eye is quieter. Then you can see how the pattern of the iris. Iris pattern is ironed out iris pattern. You can see the ghost vessels, and also there is a atrophic pupillary rough. These are the typical findings. Along with that, you can see the patient having a corneal edema and also bullae. So these are the findings that you should remember when you are looking at the patient with the neovascular glaucoma. Thank you. Hope this is useful for you.